So, we want to have a look into the concept of hypertension and how hypertension has affected the whole world. So, this is what the epidemiology of hypertension, high blood pressure in patients, of course. You know, so this is a map, and it's just trying to look at the density. You know, so hypertension, just so you know, is actually one of the most widespread non-communicable disease. Non-communicable disease means it cannot be spread from one person to another. Okay, it's an individual thing. Okay, but a lot of people seem to still have it. So it affects about 1.4 billion adults. That's people aging between 30 to 79 worldwide. As of 2024, I'm recording this video in 2026. So this data was 2 years ago. Okay, and a lot of these adults being affected are in low income countries, that's developing countries or middle income countries. So say that about 1.4 billion adults are affected, about 33% of adults in those groups, about 33% of adults in this age group are affected. I don't understand that. All right, you could just leave that out. So prevalence by region is the Eastern Mediterranean region. Okay, you can pause this to observe the map. Okay, it has the highest, about 38%. Western Pacific region, 29%. Okay, these are the regions that have the highest. Okay, so awareness and control. About 44% of adults with hypertension are even unaware that they have hypertension. So they won't even report to the hospital. So this is actually one of the issues we face. Only 23% of them have their blood pressure under control. So some of them know, but they are not under medication. So in many countries, national control rates are below 20%. So the number of hypertension rose from 650 million in 1990, and in 2024 we have about 1.4 billion. Okay, so you might feel this is just numbers till your family member dies from it. Okay, so it's not just numbers. So projections suggest that it will keep remaining high, with men having the highest rate, you know, and women usually have it most at times when menopause have set in. Okay, so risk factors. We have the modifiable and the non-modifiable. Modifiable are the things that you can advise the person to stop, like taking high salt. The person is fat, so do exercise and reduce your weight. Physical inactivity, you're just in one place, you're not doing any exercise. Tobacco use, alcohol consumption, unhealthy diet, and also environmental factors like air pollution. So non-modifiable now, there are things that they are part and parcel of this person. You can't change. Like the person's age, you can't change your age. Genetics, you can't change your makeup. Family history, you can't change your family. Okay? And also if you have some underlying disease conditions like diabetes and also kidney disease, they make it easier for you to have hypertension and it moves faster. Okay, so I think this is what we have. So impact is a health burden. So hypertension is a major cause of heart disease, like to go on to cause heart disease, stroke, heart failure, dementia, and this is what kills most of the patients. So cardiovascular diseases linked to hypertension are projected to cost about 3.7 trillion naira to a country to manage. They actually subsidize drugs for patients, a lot of things. They pay for insurance for patients. So the country is spending this amount, US dollars, 3.7 trillion US dollars on just a disease. So World Health Organization have some target for us, and they said that by the year 2010 and 2025, they should reduce it by 25%. But I'm recording this video in 2026, and this is yet to be achieved. Okay, so I think this is what we got for the epidemiology, trying to have an insight to how this disease condition has affected the world at large.